So I wouldn't call them side effects per se, because most of what you mentioned now, the dry eye and the light scattering at night time that we usually see for the first few weeks after the procedure are all temporary.
Even, sir, I say that it's going to happen to the person who is already having dry eyes before also.
Exactly.
Yeah.
So it's the same thing only after surgery.
Yeah.
If you talk about glare, then I'll start looking at like the glare, right? Then you'll actually see glare.
Glare.
So that's
Exactly. So that's a tissue's normal healing response to an intervention. That's it. So you have to be patient enough. You must also not keep focusing on it.
Yes.
If you look for light scattering, if you look for halos and glare, you look for dysphotopsia, you're going to see it more. Just like your floaters.
Exactly.
You look for floaters, you're going to see more of them.
Yeah.
As long as you just ignore it, give it its own time to heal, most of these effects are going to be gone in about a few months' time.
So most of the chance of side effects are less than 0.5%. And in that 0.5%, most of them with time, it actually reduces. And these side effects can actually be treated in case it doesn't reduce. So that is what you need to see.
So I call them an adjustment phase. Like, and I obviously tell them beforehand, this things might happen. Rather than them sitting on our, in the OPDs on the post-op day one, I'm having this problem, I'm having this problem. If you guide them properly, this thing might happen. It's probably a temporary thing, a temporary shift, because we are changing the shape and the structure of your eye. But with couple of few weeks, it's definitely going to go away. So if you prime them beforehand, they're comfortable.
And also the way somebody takes care of their eyes in that post-operative period is so important. It's the difference between somebody being comfortable within 2 weeks versus somebody not being comfortable for 2 years. If you strain your eyes in the first couple of weeks, you continuously have like 18 hours of screen time without breaks, you don't use the drops properly, don't blink, you're in a very dry environment like AC and office. So these are the things. It's like, getting a surgery and then having to do physiotherapy. Although that time is very less after laser vision correction, it's important. So if somebody takes care of their eyes really well immediately after the surgery, then their recovery is a lot faster. There are people who are uncomfortable chronically for a longer period of time. So I think that makes a difference.
I think that can vary a lot patient to patient, and you have to again, reassure the patient that these are normal changes. But usually what I'll tell the patient is, especially after a procedure like SMILE, that as long as you're comfortable, do it. If you feel tired, if you feel strained, take a break. But other than rubbing your eye and just being irregular with the drops, there's really nothing else that you can do that can cause harm.
Yeah.
So it's just important that be comfortable. Don't push yourself too much.